Ladies and gentlemen, colleagues, we are here today to commemorate the 50th anniversary of the Harvey Cushing Society. As a part of these commemorative events, the program committee of the now American Association of Neurological Surgeons, formerly the Harvey Cushing Society, has asked that certain members of the organization who have been formative in the development of the society be interviewed because of their particular formative period in the society. One of those individuals is Dr. Frank Mayfield, who in 1965 was president of the society when a major change in the direction of the society took place in what has come to be known as the Mayfield Proclamation. The American Association of Neurological Surgeons was formed as a spokesman for American neurosurgery. Dr. Mayfield, would you set the scene as to what was happening at this time that led to the development of this concept of the American Association of Neurological Surgeons?
I'll try. John, I would like to open by saying that I'm highly complimented that the anniversary committee would consider my thoughts important to this matter, and I want to say to you that I can't think of anyone that I would rather share them with, so I'm delighted that we're having this interview together. The experience of medical organizations, I think, is very similar to that of political organizations in general. 13 colonies formed themselves into a union and then stood by and made the territories apply for membership. The neurosurgeons of the country sort of did the same thing later on. In 1920, I believe, the Society of Neurological Surgeons was organized, but then became a rather exclusive club based on their own criteria of admission, so that in 1931, among the several of them who needed an opportunity to share with their peers, to be accepted by their peers, organized the Harvey Cushing Society. It was of different base, so escape from the rules of the Society of Neurological Surgeons was the only basis for it. And then in 1938, 7 of us who thought that we were pretty, well, at least we were a little bit bombastic at that time, were invited to Memphis with the assurance that by our sponsors that we would be elected to membership in the Harvey Cushing Society. Something happened in the business meetings which seems to be prone to occur, and none of us were elected, and we were bitterly frustrated. We felt that we had qualified, and so with a bottle of Dr. Sam's whiskey, we retired to one of our rooms and organized the American Academy of Neurological Surgery. Not a very noble beginning for what has come to be a very honored organization, but unfortunately we sort of closed ranks and didn't provide for others to follow us as others had done to us before. So we made that mistake, and that was the basic background that led up ultimately to the situation in 1965. Subsequently, the Neurosurgical Society of America was organized, did essentially the same thing. Then the Congress was organized. And the Congress has fulfilled its mission. It said it was going to provide an avenue for young neurosurgeons at all stages to be available on their own, to have access to the communications with their peers, and they've adhered to that. On the other hand, they excluded themselves properly from being the national spokesman by placing a limit on the upper age. I believe it's 45. You're important. I am an honorary member of that, but I think you know the circumstances better than I. And so I had felt that it was a mistake for the Academy to close. I thought that it was a mistake, though I had no part in the Neurosurgical Society of America. I was elected to the Cushing Society in 1941, and I expressed this view that the Cushing had made a mistake. I believe Dr. Ed Fincher was presiding at that time, and he appointed me to a committee to work out some change in the method of election to the Cushing Society. And we brought in a report recommending that 2 categories be established: one, full fellowship on the basis of certification by the American Board of Neurological Surgery, and other, an associate type of membership for those less qualified. We got half of it. They did change the Constitution to specify that those who had qualified and were certified by the American board could apply, and unless some moral reason were found, they could not be excluded. But that still didn't meet the general need. I love the Cushing, and I still think of it as the Cushing, even though it is now the American Association of Neurological Surgeons. But there was still an ongoing need for a national spokesman. I participated in every meeting, or nearly every meeting, but I was terribly surprised because I missed the meeting at which I was made president-elect, and I was terribly surprised to find that I had been named president-elect because I'd really taken no significant part in the government of the organization thereafter. So that brings us up to the approach period.
What was the process at that time by which the leaders of the Harvey Cushing Society were selected?
Well, until this most recent change in the Constitution, the Board of Directors was the nominating committee. And while there was an opportunity to nominate from the floor, it was one that was never exercised. And I've often wondered how I got to be nominated. I suspect even Alexander might have been my sponsor in that, but he would never admit it. And but whatever it was, I was notified by a telegram that I was the president-elect. And Barnes Woodall was then becoming the president. And so I recognized that it would be an opportunity to fill a void in medical organizations for neurosurgeons. And I began to discuss this with many people during my year as president-elect. And I found that not only were most of them in agreement with the concept that we needed a national organization as spokesman for the neurosurgical groups, but were enthusiastic in its support. Dr. Alexander was particularly helpful. He was the secretary of the Cushing during that time. But I found no resistance from anyone. I was a member then of the Society of Neurological Surgeons and also of the American Academy of Neurological Surgeons. And I talked it over with the officers of those two groups, and they agreed that some change was needed. And I was not a member of the Neurosurgical Society of America, but a number of those people, but I remember particularly Bill Meacham and Colin McCarthy being very helpful in persuading that group to go along with the concept philosophically. And we then came to the time of the meeting in New York, and the group that we were most concerned with was the board of directors of the Cushing. A lot of them loved that society in its form as it existed there, and would be jealous of changing its stature and its nature. On the other hand, we did have some heated debates that first meeting of the board of directors, but with one or two exceptions, all of them agreed that the principle was correct.
Was the concern about the organization becoming more democratic, or the possibility that a change in the name might be required?
Well, I think all of them had an emotional concern about changing the name, but that wasn't a serious issue. And I don't think they were really concerned about the democratic principle. They just had enjoyed the camaraderie of close association in group that was small enough that you could go to somebody's clinic and at times even have an operative clinic and things of that sort. And I think it was just that they were afraid that would go, and I think most of them recognized that the time had passed when organizations of that stature could limit itself to such a group, and so it really wasn't very difficult. All of the members of the board of the Cushing at that time were concerned as to what the reaction of the Congress would be, which was then a very large and very viable organization, and I had been led to believe that we might meet something less than enthusiastic support from the Congress, but it turned out not to be so. Bland Cannon was in attendance at the meeting, and he I think was a past president of the Congress, and he assured me that I would find the officers cooperative, and I did talk that night to Gordon Vandernort and to Bill Mossberg, who I believe held the office of President and President-elect of the Congress. And again, they said they couldn't commit their organization to the principle that they were and that they would try. Well, I thought if the President and the President-elect were both committed to it, there was a pretty good bet that it would work. And I went back to the Cushing board, and they said on that circumstances that you can make the announcement that we will be the spokesman for neurosurgery. Now, Francis Murphy had come on as President-elect, but was not present at that first meeting of the Board of Directors at New York that time. But I knew from personal conversations with Francis that he was completely in support of the idea and was willing to commit his administration to the transition and organization, and he did give it magnificent leadership.
Were there governmental and bureaucratic problems at that time? Since you had 5 neurosurgical organizations, who did the government look to as the spokesman for neurosurgery?
Well, I'm glad you asked that question, because it comes to it was the key catalyst in bringing them all together. This then was in 1965. Mr. Johnson was the President of the United States. He, in addition to the Great Society, or whatever it was that he called it, he had organized and had the Congress approve the Great Attack on Heart Cancer and Stroke. Mike DeBakey, as most of us know, was the prima donna in the heart side of it, and which therefore included also the stroke side. And he appointed John Sterling Meyer as his subcommitteeman to deal with the stroke issues, and this tremendous amount of money as well as important responsibilities. And John wrote letters to the various organizations, the Society of Neurological Surgeons and the Cushing Society, and he couldn't get any answer and as to what the role of this would be. So he just up and appointed somebody of his own. I think it was Dr. Sasso that I forgot now. And so I knew that, and I included those letters in my presidential address. The editor thought they should be deleted for publication purposes, but then when I said that, the other organizations who already were moved, I don't mean that that was the whole catalyst. They were thinking about it hard, but that removed any doubt, and all of them then agreed that it simply was a question of finding the best way to put together an organization. And it was this point that Murphy really did the negotiating. I'm sure I wasn't a part of that, and except as an advisor. I'm sure that each organization bargained pretty hard for its right in the new structure. And I think you'd have to go to Murphy or someone else to find out just what they got. But this is a pretty common experience in human affairs, you know, when you've sort of agreed to principle, then to deal your chips as closely as you can.
So then that all 5 organizations became represented on the board of directors.
Oh, yes. Oh, yes.
In a fashion that gave equal opportunity for each to have a spokesman. And the American Association of Neurological Surgeons was born, and as a result of this proclamation and the total support from all organized neurosurgery, became truly the spokesman for neurosurgery and dealt with the National Institutes of Health, other governmental organizations, and the increasing problems that we were confronted with, malpractice and health insurance rates and many other factors.
Yes, it was an organization now with the authority and the capability of dealing with all those matters, and to begin to deal with other national medical organizations. Of course, the most pressing issue was the inroad of the government into medical affairs, but up until this time, it played comparatively little part in the American Medical Association, the American College of Surgeons, but almost immediately avenues were then created for not only official but active representation and participation in those organizations. Last evening when we were discussing this, you asked me about the relationship to the AMA. I have, you know, always regarded the AMA as the principal organization in medicine to which all of us should and must adhere. On the other hand, there was no place for the specialty of neurosurgery, but that particular year, this was coincidence and good luck, the House of Delegates of the AMA adopted what was known as the Quinn Report, which made every national organization eligible for a delegate in the House of Delegates of the AMA, and also created section councils and they wanted section councils of 5. Well, I happened to have been chosen then to be the first delegate to the AMA. I think Ernie Mack was my alternate. Don't better slip on that. But anyway, there were 5 organizations participating in this, so lo and behold, whoever made the decision appointed one from each society, and that was proper and correct, and it went on to be a very effective organization. It's since, that is the section council of the AMA. Subsequently, the AMA has changed its policy a little bit in that regard, but it strengthened neurosurgery and all other disciplines rather than weakening them, because now we have a delegate from both the AANS and the Congress and the section council, but this was in a trade with the AMA for paying the expenses of the delegates. This great number of delegates was expensive for the AMA, and so they were willing to grant another representative, provided somebody would pay the bill for their travel expenses.
More recently, the representation to the American Association of Neurological Surgeons has taken another change, what has been called an even more exercise of an even more democratic process. Why has this been necessary, and has it been an effective move in your opinion?
I agree that it was necessary, not on substance, but because of the local circumstances that existed at the moment. You will be better prepared than others to know whether it will serve its purpose. I think it will. There was a feeling among some, I never thought it was justified, that that they were being excluded from the government role, from the governing role or participation in the government of the Cushing Society. I don't think that was a fact. And the number of organizations, state neurosurgical societies, which were necessary and are necessary and important, regional councils and all, wanted to take part, and they created considerable argument, just or unjust, that representation on the board of the American Association of Neurological Surgeons wasn't adequate. The leaders at that time, after much study, and I was consulted from time to time, though I certainly wasn't making it in a role to make it in a position to make any decisions about it. It was carefully studied, and it was considered that this was the best course in order to eliminate that doubt in people's minds. I hope it will serve its purpose. I think it will. I certainly believe that constitutions or government structures are only workable if the people want them to work, and it's much more important than the actual wording of the thing. So I think it'll serve its purpose. Someone, John, has said that that the strength of democracy is the right to choose one's leaders, but the survival of democracy depends on choosing aristocrats to do it. And so I think, I don't want to be a snob in this regard, but I think who is chosen to lead is more important than the method of choosing them.
I've heard you and others say on many occasions that you think the House of Delegates at the AMA is one of the most democratic organizations you've ever worked with. Can the AMA and its House of Delegates represent specialty societies such as neurosurgery adequately, or should we consider a move which has been proposed that within neurosurgery we have a House of Delegates and a process similar to that discussed or trend that we're going with, the increasing democratic process of election of our delegates to the AANS?
I'm reluctant to answer that question, not because I don't have a firm opinion, but I don't want it to be critical of those who hold a different view at this moment. I think if an organization of the size of the American Association of Neurological Surgeons, and we certainly are talking about a group less than 4,000 people, has to go with the minutiae of delegations and so on, that it would destroy itself. If the issues that we are called upon to solve, not in the self-interest of the neurosurgeons, but in the interest of the people that we have to do it, hinge on such a thing like as a House of Delegates that would sort of amount to a Harper Valley PTA, it would become absurd. At the present time, the the American Association of Neurological Surgeons and the Congress of Neurological Surgeons and the Society of Neurological Surgeons and the others, each playing a very important and constructive role in funneling it through the American Association of Neurological Surgeons. That role is being played in education and in community service and in the political arena. And I just don't believe that anything but weakness would come if you went toward a House of Delegates. That's my own personal view. Others, with times change and circumstances change. And any organization that doesn't adapt to change is going to die. So I don't think any period at any moment that a constitutional structure should be cast in stone. I had no objection personally to the change in the Constitution as it was adopted. I just didn't think that the arguments that were raised made it necessary, but enough people did think it was necessary, so it's done. So I would hope that those who constitute the American Association of Neurological Surgeons would look very critically at the idea of creating a House of Delegates. It would be wrong in my judgment.
Dr. Mayfield, you've been called a spokesman for neurosurgery for many years, and one area that you're particularly interested in is the marketplace, or the question as to whether or not we are training too many neurosurgeons, and should it be restrictively controlled, or should the marketplace itself be the determinant of the number of neurosurgeons? This is an increasingly important question, particularly in view of the recent GymNAC studies. Have you changed your opinion about this matter in view of their findings?
No. John, to assume that one can control needs and opportunities assumes that someone has the wisdom to know what we need, you see. And I don't believe anybody exists that can know now in the future what is needed in numbers and so on, unless you're ready to cut the taproot of science and medicine and so on so that it can't grow. When my graduate experience in medicine happens to coincide with the lifespan of the Cushing Society. I graduated in 1931. It was organized at that time. They certainly had no relationship at the moment, but it wasn't long before it began to influence my life. Now, at that time, Dr. Cushing's work and Dr. Dandy's work largely, though Dr. Fraser and many others were participating in it, was intracranial surgery, and mostly for brain tumors, some intraspinal surgery. The World War I had involved peripheral nerve surgery, but the other basically was intraspinal surgery. No one was aware at that time of the intervertebral disc problem, which was certainly dealt with only by neurosurgeons for many decades, you see. Now, God, if we'd only had the number of neurosurgeons that could do only brain tumors and aneurysms, then we would have been hopeless, you see. Now, and certainly Dr. Cushing couldn't anticipate the many methods of pain control, some of which are good, some of which are bad, or the attack on aneurysms or vascular disease and all those kind of things. So it is a growing problem. We work ourselves out of a job, hopefully, as we go along. I think Dr. Cushing did found the science of endocrinology simply by studying his own patients well. And the Dr. Edson and Dr. Pete, and I don't know, not trying to give priority to any one of them, had the fortitude to attack the sympathetic nervous system in the treatment of blood pressure, high blood pressure. You don't need it anymore, but out of this, the chemical control of the blood pressure system was developed. Similar applies to the work in the treatment of psychiatric disease and many others. So we are constantly, if we do our job right, working ourselves using the day's therapy as a means of developing something that will displace it. And that's what, and I don't think there can be any too many people who do it that well. Now, I believe strongly in quality control. Again, that assumes that someone has the capacity to decide what is the right quality. But I think I'm on record in a number of places, and Paul Busey and many others wholly share the view that responsibility such as you hold now for graduate training in neurosurgery, if you control that quality, you can't produce too many, do you see? It's a great responsibility on you and all of the other people who have responsibility of selecting the student, of giving him his opportunity, giving him the opportunity to go. And if your people don't perform well, then you ought to be the one to lose your representation, not the student.
I couldn't agree more that the selection process is the most basic and important one. What should be the role of the national organizations, particularly the spokesman, the American Association of Neurological Surgeons, in ensuring the continuing competence and ability of the trained neurosurgeon once he leaves the university? Does the program director share that responsibility with the national organizations? And if so, how should he implement it?
Well, you ask comprehensive questions. Don, I don't think that there is any difference in the responsibility or the obligations of one who is a professional educator or who is responsible for a graduate training program than those of who only practice. The academia should not be identified with the bureaucracy of universities. Academia is where scholars gather in order to advance knowledge and improve circumstances. And any community hospital that doesn't do that is defaulting, you see. So now it's true that under the organizational skills of the great universities, most of the fundamental observations will be made. I recognize that. On the other hand, I don't think that they have any more responsibility nor any more native skills in maintaining the high level of standards than all of the rest of them. I use the term carrying your park bench with you, and Aristotle sat on a bench in a park, and he did a pretty good job of teaching, and if you just carry it along with you, I think it'll work. It's sort of a rambling answer to a question. Every one of us in medicine and any other profession and in society have a absolute responsibility for seeing that ethical, professional skills are maintained to the utmost, recognizing that human frailty will let some of them slip over once in a while.
I've heard you speak many times about the tribal rule. It's a concept that's always impressed me immensely. Do you care to elaborate on that concept?
Well, it sort of bears on the question you asked me a moment ago, and and it certainly reflects the mood that the seven of us, that was back in 1938 had. We wanted to be recognized and accepted by our peers. We had accepted the guidelines of training that our teachers had given us, and we had qualified, so we thought. And then to be rejected sort of denied the basic emotional satisfaction of being accepted by your peers. Well, I think if using you as a case and example, if you choose a young man and a woman and carry them through the preliminary period so that you now are agreed that they have the intellectual and physical skills and the moral integrity to justify that, then I think they have earned the right to be recognized, and that there's certain rights that no one could take away from them. And I assure you that I've commented on it many times, and I suspect this is what you are thinking about. But I was sent to visit a number of the leading neurosurgeons of the country during the last year of my residency, a practice which I strongly encourage everybody to engage in. And I was accepted with the dignity as if I were Dr. Coleman, who was my chief, you see. After he went through the formality of being recognized, he usually turned me over to the resident, and I wasn't, but at least my right to be there was identified. And I feel very strongly about that, and I have said repeatedly that, and I believe you feel the same, that you have certain rights that you earn after you've been accepted into the tribe. Now, if you have those rights, then the tribe has a right to impose on you certain rules of behavior. Yes, I feel very strongly about it.
Dr. Mayfield, you've always been an inspiration to young men in neurosurgery and many other fields also. Particularly refer to your address to the Congress and its residents. As we terminate this interview, I wonder if you have any words that you'd like to say to the young men in neurosurgery as a parting comment, one who's observed the scene in neurosurgery throughout the development and now the fruition of the American Association of Neurological Surgeons.
Oh my, wouldn't one like to come up with a wisdom like Neil Armstrong did when he stepped on the moon, but I can only say that I'm awfully happy to have been a part of it. I'll watch each one of them with interest and concern, and I'm sure some pride. Thank you.
Thank you very much.